Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, data from Indigenous lands and people. We hear about an effort to make sure that tribal communities benefit. Joseph Yracheta is a biomedical researcher and doctoral student at the Johns Hopkins Bloomberg School of Public Health. He's also the executive director of the Native Biodata Consortium, where he works with the National Institutes of Health and tribal nations. He joins Dr. Josh Sharfstein to talk about efforts to advance biomedical research while making sure that communities are not exploited in the process. Let's listen.
Joseph Yracheta, thank you so much for joining me in Public Health on Call to talk about your very, very interesting and important work.
Thank you for having me.
I'd like to start by asking you to introduce yourself to our audience. Where are you today recording this podcast, and how have you gotten there?
My name is Joseph Yracheta. I am the executive director of the Native Biodata Consortium, which is a 501c3 research organization that houses sample and data within the boundaries and legal jurisdiction of an American Indian nation in South Dakota.
Where are you today?
I am at my house in South Dakota, Selby, South Dakota.
Okay. How cold is it up there?
It's better. It was 5 a couple of days ago. Today it's in the mid-30s.
That's practically balmy for South Dakota this time of year.
Yeah.
And just by way of background, before you got into this work in biorepository, what kind of work were you doing? How did you get to this?
So I've been a biomedical researcher since about 1990 when I started at Loyola University in Chicago. And then after that, I moved to University of Wisconsin, where I worked at the veterinary school, and then moved from the veterinary school to surgery transplant. And sort of the central theme of all of my research has been kidney disease and sort of different exposures, most importantly, stress and diet excess. And then I moved from there to the UW Seattle and got a master's degree in pharmacogenomics. And now I'm finishing up my DRPH there at Johns Hopkins in environmental health science.
So that is a tremendous resume right there. You have a deep experience and appreciation for the benefits of biomedical research. But before we started the podcast, you said, for the Native community, this research is at a crossroads. Could you tell me more about what you meant by that?
So for a long time, American Indians have had some of the worst and longest lasting health disparities. And there's a lot of political reasons for that, and also logistical reasons with the Indian Healthcare Service. But after the mapping of the human genome in 2003, American Indians and other isolated populations, whether they've been Mendelian or island populations or populations that are culturally isolated like the Amish, all of a sudden these types of folks are very highly sought after because of the genetic associations and predispositions that people assume that they have. But for American Indians, they have a federally recognized and pre-existing or pre-Columbian sovereignty, which allows them to self-determine pretty much everything: economy, law, healthcare. And because the technologies are so powerful, and because the remunerative or restorative justice has waited so long for tribes, we should be able to sort of raise all boats with this data and provide better healthcare services and quality of life.
So is it that, on the one hand, the potential of research is there to identify problems and suggest solutions, but on the other hand, there are a lot of reasons to wonder whether those solutions will really be benefiting the people who are contributing to that research?
Yes, and as I said, these Mendelian populations, people with Tay-Sachs or sickle cell disease, brittle bone disease, already have been a boon to pharmaceutics companies. But, in terms of intractable or logistical reasons, a lot of the actual benefits to those populations has been lacking. And we don't want to have the same repeat with American Indian populations.
And so what are you working on to try to avoid that repeat?
So the Native Biodata Consortium is a product of about 10 years of thinking. So UW Seattle was unique at the time that I was there in that there was this sort of indigenous renaissance where there were Native people from the Pacific Ocean, from Alaska, from the United States, Canada, and Latin America. And we were all working in different fields, but we all wanted something like the Native Biodata Consortium to get data working for Indigenous people, especially with the advent of the Nagoya Protocol, which was around 2009, to make sure that the resources, whether they're microbiome, botanical, soil, agricultural, or biomedical, that those resources would benefit Indigenous people first. And so we created the Native Biodata Consortium in 2018 after, like I said, about 10 years of thinking about it. And our board are all researchers. They're all biomedical researchers. They're all Indigenous from some parts of the world. And then our staff is also unique in that they're all Indigenous as well. So we have, this kind of tripartite governance with the board of directors, the staff, and then we have a community advisory group from the reservation where we reside to give us advice on the things that we do. So that's what we've done, is create the entity, and we've been very successful in large part because of COVID and philanthropy during COVID to get our legs underneath us. And now we've moved more over to federal funding, including we won a $9 million award called the RADx Up Tribal Data Repository.
Tell me about that award. What data is going into that repository?
So as some of your listeners might know, the RADx project was rapidly instantiated to deal with the pandemic. And RADx Up specifically was for underrepresented populations. And so there's about 11 projects that were fielded during that time. But for the most part, those projects with their PIs and the tribal leadership behind him have been reluctant to share data with any sort of open database, whether that's at Duke University or in Bethesda with dbGaP. And so one of the solutions was to put out a request for applications for a tribal data repository, which was competitive and took more than 2 years to get funded. And then it got funded. And so it's us, Native Biodata Consortium, University of Wisconsin, University of Washington, Seattle, University of California, Santa Cruz, Arizona State University, and Ohio State University. And we're all working towards mostly negotiating sort of the ethical, legal, social, and data sharing agreements between tribes, between themselves, intertribal, but also between the tribes and the federal government and outside researchers that want to access that data. So the data has been collected. They're called common data elements, but it is the lowest of priorities. It's really trying to broker the relationship for this data, which is relatively low risk, in the hopes that higher risk data like genomic information might be shared in a way that tribes feel comfortable, safe, and will receive the most benefit.
Let me ask you how you hope the Native Biodata Consortium will work. Maybe the kind of old way would be for data just to be taken and studied, and then you're kind of hearing about how it might be used, and it may or may not be helping tribal communities. But with your essentially containing and controlling the data, how do you hope to engage with researchers who either want to study plants or biologic specimens like blood samples? How do you hope that conversation goes?
So tribes in the late 1800s, early 1900s went through something called the Marshall Trilogy, which removed some of their sovereignty, but instantiated other parts of their sovereignty as domestic dependent nations. recognizing formally that they have the right to create their own laws and manage their own resources. And that was all sort of re-emphasized with a bunch of legislation in 1975. Because of that, tribes are critically aware of what is theirs. The rest of the country thinks that they're regular American citizens and that they are part of a larger body politic where their data is mixed with other American data and that it benefits everybody. What we're trying to do is make tribes more like Google or 3M or Regeneron, where the resources and the IP and the development all belongs to them. And anybody else who wants to be part of that development will have to sign contracts and guarantee some sort of benefit.
Got it. So I'm a company, I want to do research with the data that you have, sitting down with you, and we're having a pretty serious discussion about what those questions are and what will happen with the results.
Yes.
Have you started having those conversations with potential researchers and companies and others who are interested in the data that you are collecting?
As you can imagine, it's a long, slow process and a tremendous learning curve, not just for tribal leaders, but also for external researchers. So the leaders need to learn the science, the outside researchers need to learn the politics and the history. So yes, we've begun having those conversations, but at the moment, what we are focused on is, and you might have heard of this already with NAGPRA, a lot of universities are having to return skeletons and artifacts and other biologicals to tribes. We are on that trajectory right now. Is all of the biomedical data that's been paid for by the NIH that exists in freezers or on servers at different universities, we are actively getting tribes to ask for that data and repatriate it to us, at least temporarily, until they can set up their own servers so that they'd have that kind of control of what happens to their data. And that's what we've been focusing on. And we don't really make decisions for the tribes. We consult with them and help them make their best decisions.
Got it. So in a way, you're an intermediary between people who'd use the data and the people who it really is their data.
Right.
Let's say it's 10 years from now. We're redoing this podcast. Public Health on Call is now in year 14 or something like that. How do you hope the story goes then? What do you think could happen if this all goes well?
I think you're aware that when you do these large studies, like say right now with H3 Africa, that the data that is shared between countries has a lot of regulation, but in a way that everybody benefits. And that's what I hope, is that it isn't necessarily the size or the economic might of a country, like say between the United States and France, but that smaller countries like Indian nations will have the same sort of respect and the same sort of working relationship, so that this whole idea about ownership and profitability isn't unidirectional, and that we can actually get to a point where we are truly raising all boats for the global population.
Well, Joseph Yracheta, thank you so much for joining me and sharing that vision and for the work that you do.
Oh, thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.